and welcome to Wellness Watch, a show that explores the nuances and the burden of illnesses and diseases on mankind and how we in India are dealing with it. Today, we discuss another very important organ of our body. We rush for help when the heart stops, but what about when the brain calls for help? Just like the heart attack strikes the heart, a stroke or a brain attack strikes the brain. In the blink of an eye, a stroke can change everything: speech, memory, movement. A silent emergency that strikes without warning. Today in Wellness Watch, we discuss brain attack, commonly called as a stroke. I'm Preeti Kaur. A stroke, commonly known as a brain attack, is a medical emergency that requires immediate attention. A sudden twist, a frozen smile, a word that won't come out. Now, these could be the first signs of a stroke. If treated on time, not only can a person's life be saved, but the complications and side effects can be largely controlled. As World Stroke Day was observed on October 29th, this special report by DD India's Harshita Oberoi looks at how a stroke affects a person and what factors can increase the risk. A stroke is a serious medical emergency that occurs when the brain's blood supply is disrupted. This interruption may result from a blocked artery or bleeding within the brain. Often described as a brain attack or cerebrovascular accident, a stroke cuts off oxygen and nutrients the brain needs to function. In an ischemic stroke, a blood clot blocks the vessel carrying blood to the brain, while in a hemorrhagic stroke, a weakened blood vessel ruptures and causes bleeding inside the brain. Sometimes, the brain experiences a temporary blockage that mimics a stroke known as a transient ischemic attack. Often called a mini stroke, it lasts only a few minutes and does not cause permanent damage. But it should never be ignored. A TIA or transient ischemic attack is a warning that a major stroke may occur soon if preventive steps are not taken. The most effective way to recognize a stroke is through the FAST method. Face drooping, paralysis in the face, one side of the face may droop when smiling, numbness or weakness in arms and difficulty in raising the arm, trouble speaking and understanding what others are saying. Words may slur, sentences may not make sense. Acting quickly when these signs appear can reduce brain damage and save lives. So, who is most at risk? People with high blood pressure, diabetes, high cholesterol, obesity, or those who smoke or drink heavily are more vulnerable. A sedentary lifestyle, sleep apnea, and heart conditions also raise the risk. A stroke can lead to serious complications: loss of muscle control, trouble speaking or swallowing, memory loss, and emotional changes. Recovery depends on how quickly the treatment starts and which part of the brain is affected. Diagnosis often includes a physical exam, blood tests, imaging tests like a CT scan or MRI to determine the type and severity of the stroke. Treatment varies. In an ischemic stroke, doctors remove or dissolve the clot. In a hemorrhagic stroke, they control bleeding and pressure in the brain. With timely treatment, physiotherapy, and rehabilitation, recovery is possible, and independence can often be regained. World Stroke Day is observed on 29th of October annually, reminding us how critical awareness and timely action are. While a stroke may strike suddenly, prevention lies in our hands. Eat healthy, stay active, manage blood pressure and diabetes, avoid smoking and excess alcohol, and get regular checkups. Because when it comes to a stroke, every minute counts and every choice matters. Harshita Oberoi's report, Wellness Watch, DD India. All right, so stroke is a leading cause of death and disability globally, with rates increasing fastest in low and middle income countries. According to WHO, 15 million people worldwide experience a stroke each year, resulting in 5 million deaths and another 5 million permanent disabilities. Key risk factors include high blood pressure, high cholesterol, diabetes, obesity, smoking, and physical inactivity. World Stroke Day is observed every year on October 29th. The theme this year, Every Minute Counts, emphasizes on the critical importance of acting fast to recognize stroke symptoms and get immediate medical treatment. Today in Wellness Watch, we look for these answers. What is a stroke? What causes it? What are the types of stroke? What are the early warning signs one should look out for? How can strokes be prevented? And we also discuss the medical advancements in India in this field. All right, treatment for a brain attack or a stroke in India includes emergency medical interventions like IV clot busting drugs or mechanical thrombectomy to remove blood clots, medications to prevent further clotting, surgery or some cases, and also rehabilitation to help with recovery. Treatment depends on the stroke's type and severity, and also swift action is critical to minimize brain damage. Up on your screens, we have some hospitals and institutes which specially cater to this. All India Institute of Medical Sciences, Delhi, Safdarjung Hospital, Delhi, the National Institute of Mental Health and Neurosciences, NIMHANS, Bengaluru, Sawai Man Singh Hospital, Jaipur, Postgraduate Institute of Medical Education and Research, Chandigarh. So these are some of the prominent hospitals and institutes which cater to brain stroke or brain attack treatments, providing world-class and economic treatment. To discuss brain stroke in detail, we are joined in by guests. We're joined in by Dr. Rajesh Kumar Singh. He's Additional Professor, Department of Neurology, AIIMS, Delhi. He is there with us in the studio. And we're also joined in by Padma Shri Dr. M.V. Padma Srivastav. She's Chairperson, Neurology, Paras Hospital, Gurugram, and former Professor and Chief of Neurosciences Department, AIIMS, Delhi. She's joining us virtually. Thank you so much, both of you, for joining us this afternoon on Wellness Watch. Dr. Padma, to begin with you, I would want you to explain to our viewers in simple layman terms, what is a stroke and what causes it?
You already described it so well, Preeti. So yes, stroke or brain attack, emergency is when there is a blood flow going to the brain, there is an artery, the artery is blocked suddenly, there's no further flow. That is an ischemic stroke. There is a blood vessel, the vessel ruptures and there is bleeding inside the brain. That is a hemorrhagic stroke. It obviously is sudden, it's apoplectic, so it is like a bolt from the blue. Said that, there are several subtypes of this ischemic stroke. Whether the clot is happening within the artery or the clot has happened elsewhere in an artery, say from a heart, and it has got pumped up into the brain, called an embolic stroke. And why did the embolus happen? Is it because of a rhythm disturbance which happens in the heart, or it is a valve problem like say rheumatic heart disease within the heart, or because there is an infection process within the artery? And what kind of an artery is involved? Big vessels. So if you look at your own, Preeti, just look at your, your little finger.
Yes.
And the size of this little finger and the half of it is the size of the artery which is going into the brain. There's a big artery.
Right.
So those big arteries are involved is called large artery. When this artery branches into like a tree, there's several little twigs.
Yes.
They're called small arteries. And then even smaller branches called lacunar stroke. Now look at the diversity of what a stroke is and what are the varieties of stroke.
Right. I'll take that forwards to Dr. Rajesh. Dr. Rajesh, ma'am tells us that a stroke is sudden. Is it always random and sudden, or what are the early signs or the warning signs that a person should look out for?
Yeah. So basically, stroke means sudden. So the attack you have shown in the report previously that we should act fast. So the symptoms are explained in that, like if there is a facial drooping of the face, one half of the face, if there is any weakness of one limb or one side of the limb, or if there is slurring of speech. So this is the basically these three are the symptoms of a stroke. It can, however, occurs in the form of imbalance while walking. So these are the symptoms of a stroke which we should be aware of, and we should not neglect, because sometimes these symptoms improve, and these are known as TIA, transient ischemic attack, and that can lead to bigger stroke, and that has consequences if not treated adequately or early. So, these are the symptoms which we know. It can, even if it is a hemorrhagic stroke, the patient can become even unconscious. But the ischemic stroke, if it is small, these are the symptoms which he can present.
All right, ma'am, you talked of the variety of strokes and,
Preeti,
uh,
Preeti,
yes.
can I come in just because that you so nicely put up, Dr. Rajesh has already said that fast. Now from the World Stroke Organization, the mnemonic is be fast. In fact, they've changed it to fast B. So FASTBE. So it's
All
like a
right.
bee, the
Yes.
bee, you have to wings and just run. So B basically balance, and E is for vision. So sudden vision loss also is there. So in
All
the
right.
rest of it, so the mnemonic has been changed, so it becomes, sort of more attractive. We start off with school children.
Right. All right. When we talk of the types of strokes, you're talking of how a person can face different types of strokes and the variety of strokes. But then, of the two major strokes, ischemic stroke or hemorrhagic stroke, which stroke is more severe or dangerous?
So obviously, it's the bleed in the brain. So hemorrhagic strokes carry with them higher mortality as well also higher disability. But fortunately, in the stroke belt, which is India, you have predominantly 70, 75 to 80%, which are all blocks. This is ischemic stroke. There is a stroke belt in the north and the eastern part of the country where the bleeds of hemorrhagic strokes are equal. Almost 50% of strokes are hemorrhages. But overall, on an average, it is more ischemic. So we have more treatment options there. But a bleed, yes, you're very right, Preeti. So a bleed is far more dangerous. And also there are other varieties like, subarachnoid bleed, aneurysmal bleed, and those are really catastrophic.
All right, ma'am. Also, I would want you to explain to our viewers what is the difference between a stroke and a paralysis attack.
Oh, excellent question, Preeti, because paralysis is the end result of a damage to the brain. And the damage to the brain could be, you can have a road traffic accident, have a damage to the brain and have paralysis. One can have a brain tumor, have a damage, have paralysis. So any damage in the brain, tuberculosis, any infection, encephalitis, meningitis, stroke is also a damage to the brain. You can have paralysis. Not every paralysis is stroke. Not every stroke will lead to a paralysis. So that differentiation. But then when you're equating to the masses and tell them, and say Pakshagat, Lakwa is almost equivalent to the stroke, that is a way to recognize when it happens suddenly. But paralysis can happen with any cause of damage
Right.
to the brain.
All right, Dr. Rajesh, when we talk of the symptoms of a stroke, help us understand, does that happen over the years? Because the warning signs which you just talked of, face drooping or inability to raise an arm or a change in the way a person moves, is there a specific time or is there a particular age group that is more prone to strokes? Having said that, today we are leading lives where stress is part of our lives. To what extent does stress have a bearing on a person having the chances of getting a stroke?
So yes, who are the people who are at the risk of suffering a stroke? So basically, what is about the heart attack? The most of the risk factors are almost the same for even the brain stroke, like age. Age is itself, the older person, when they have atherosclerotic plaque in the blood vessels, that can cause narrowing and can result in stroke. The other risk factors are hypertension, the diabetes, these smoking, alcohol, and stress, not directly but indirectly can augment the inflammatory process in the blood vessel, and can atherosclerosis can be accelerated, and that can become the risk factor for a stroke. So definitely these are the risk factors. Besides that, other than one more risk factor, which is the stroke is quite common in our India in younger population. Why it is so? Because of the rheumatic heart disease, these patients are the people who are suffering stroke, and particularly in the younger group, besides the other risk factors. So these we should be aware of these risk factors.
Are strokes gender specific also or profession specific? Say people who are more into brainy professions, teachers, academicians, are they more prone to
No,
strokes?
not exactly. The gender specific, yes, sometimes the hormonal changes can, the age a bit higher in the, more in the female in the during the elderly, but that is all right. The basic is the risk factors which are more important in determining which are the predisposed population for the development of stroke.
All right. Ma'am, when we talk of people who suffer a stroke, now taking preventive care, preventive measures is important, but equally important is the rehabilitation of a person who has suffered a stroke. What care has to be taken after a person suffers a stroke, and how long does a recovery take?
So, Preeti, adding on to what Dr. Rajesh said about the risk factors for stroke, because we are dealing with a lot of stroke in young people, you brought that out very beautifully. In fact, if you look at the statistics, overall 15 to 20%, that 1 in 5 is having a stroke, just like heart attacks in less than 40 years of age. And these guys, yes, we have a vertical of young BP, young diabetics, young guys whose lifestyle is going all over the place, like, smoking, alcohol. But I think it's beyond that. So we also do have what you said as a stress factor. Sleep has become emerging as an important risk that, when you do not have a sleep hygiene and you sacrifice sleep amount and quantity for in the race, which is life, that's adding on. Sleep apneas, when people are obese and then physical activity, a lot of infections and a lot of genomics, which are also emerging that, why is the South Asian countries and the, LMICs, India being the, the prototype, you not have a stroke in young, and that's the most important factor. And in gender, the peri-pregnancy group, the young women around that part of it, although OCPs now we are seeing as a significant factor in the 30, 35 to 40 years of age. But we do have a peri-pregnancy group where there is one big, blip of increase
Right.
when you talk of gender. Now, again, a very important aspect is a post-stroke disability, because that is a reality. All these glamorous things that we talk about, immediate clot lysis and all that, the actual statistics is less than 5% of whole of India is getting the IV thrombolysis at this current point of time. Now, therefore, beyond the trials, and I'm looking at the stats at 18 lakh stroke patients which happened last year, Preeti, in India. So
Right.
in 18 lakh people, you look at that 5% thrombolysis and look at the amount of, disability which is left behind. What are we doing? We just can't say physiotherapy. So there are several, those verticals which have now been developed. Again, just like earlier you treat stroke, better it is. Earlier rehab, the better recovery. In that, beyond physiotherapy, we've also brought in non-invasive brain stimulation techniques like say RTMS or TCDCS. We've got our Indian, in-house, the thing which are low-cost modules of robotic exoskeletons and the other, kinesthetic gloves, including now AI and IT, and, we have very good brains in India. We just have to tap into the different multi-disciplines, biomedical, bioengineering. We are collaborating with IIT Delhi and other, the other disciplines of science, and we're bringing in the Indian what I would say is the low-cost modules which can go on to the last mile. You need down to reach to the Timbuktu. You can't just have these verticals in metropolitan cities or in big private sectors.
Right.
So developing that, but the trust is that in the rehab program we're bringing in holistic. So we are also bringing in Ayurvedic angle. We're bringing yoga, meditation. We are bringing in, the other systems which are there more prevalent and more accessible, available, affordable in the interiors of society.
Yes.
And this has to go on. It's not that I've done it for 3 months and now I'm going to keep quiet.
Yes.
This can, at any point of time, you can intervene.
So it's not just about medications, but a wholesome rehabilitation recovery that is
there
required.
Are a lot of, there is hope, and that's what the take home should be, that don't give up.
Yes, don't give up. All right, Dr. Rajesh, explain to us, ma'am very aptly explained, what post-stroke care has to be taken. But to what extent are genes, to what extent do genes have a bearing on the possibility of having a stroke? Are strokes hereditary?
Some of the strokes are hereditary, but the majority are still the environmental factors and the risk factor which we day-to-day life. So these hereditary risk factors are very small, very little, which contribute to the stroke. So, the majority are because of the diabetes, the common things. Suppose we, I have already told the majority are just if we quit smoking, alcohol, and just check the BP and check the diabetes. If these 4 things are checked, I think about 30 to 40% of stroke can be reduced. So, these are the, but the hereditary ones contribute to less than I think 10%, and we have the mechanism to how to deal with them and treat them.
All right, ma'am, when we've shown the report, the thrust of the report was to act fast if a person suffers a stroke. Acting fast also, means bringing in medical help to the aid of the person. But then, if there is a little delay in getting medical help, can something be done at home for a person who has suffered a stroke?
So therefore, like heart attack, when they say, oh, you suspected, just give an aspirin, you can't do that at home.
Right.
So for stroke, because you do have a variety of bleed in the brain, so you can't give that at home. But what you can definitely do is that, sometimes strokes do present with, say, sudden unconsciousness, or they also sometimes present with a seizure. So therefore, trying to make them, say, there's a seizure, putting them on one side, they don't aspirate. If there's a coma and he's unconscious, again, trying to prevent, don't open the mouth and put something in the mouth. He will be aspirating. Don't do anything of that sort. Immediate response would be just pick him up and take to the nearest hospital. And this nearest hospital is where, Preeti, I'll have to bring in this, that if we are able to develop a stroke map and go to a stroke-ready hospital as soon as possible, that'll gain time, rather than just go to the nearest, your friendly neighborhood physician who may not have the wherewithal, you're losing time. And that is something which we definitely want to do, but don't give anything by mouth on your own. Yes, you have a wherewithal, you can test out a blood sugar, test the blood pressure while waiting for a help to come. But best is just reach out to the hospital.
All right. So timely medical help, medical aid is what is very important. Dr. Rajesh, what medical advancements have been made in India with regard to stroke?
Yeah, so the management of the stroke mainly depends, there are 2 basic treatments besides the medical management. There are intravenous thrombolysis, which is sometimes the patient can become all right. So, and second is in case of large vessel occlusion, when the clot has occluded the large vessel, by endovascular technique that clot can be removed. That is called thrombectomy. So, these 2 are the recent, and particularly over the last 10 years or 7 to 8 years, the thrombectomy is a very important role. And you can expect that a patient has come with power of 0 in, he can't or she can't lift his legs and hand, and after thrombectomy he has become normal. So, you can just see how the amazing the results can be. So, it all depends on time. So, these 2, the thrombolysis, the thrombectomy and the basic stroke care, these can affect the treatment and the patient can improve drastically.
All right. So, for our viewers who've just joined in today, we're discussing brain attack or stroke with our doctors in the studio. And also next we have a quick rapid fire question round. I will ask some myths and I request our doctors to give very crisp answers to bust those myths. Ma'am, stroke symptoms are always dramatic and obvious. Is it so?
Mostly yes.
One should wait to see if the symptoms improve, Dr. Rajesh.
No.
Aspirin can prevent all types of strokes, ma'am.
No.
A stroke affects only the brain.
No.
A stroke is always fatal, ma'am.
No.
Using artificial sweeteners lowers the risk of a stroke, Dr. Rajesh.
No.
All right, with that, we end this discussion here. Thank you so much, both of you, for joining us this afternoon on Wellness Watch and helping us understand brain attacks better. So after this wholesome discussion, we did understand that a healthy mind drives a healthy life. Don't let a brain attack stop that rhythm. Protect your brain like your most precious asset, because it is. A healthy lifestyle, quick action and awareness can turn a stroke into a remarkable story of survival and strength. Remember, every second counts. Act fast, think smart. On that note, we end this edition here. Thanks for watching Wellness Watch. Bye-bye.